Right, so good afternoon all. Welcome to this drop-in session that will be hosted by CosTech Dental Laboratory, looking at Digi-Dentures. This is following the go live of scans producing a digital denture provided by CosTech. It's a short 30-minute session that Neil and the team will take you through. Just some housekeeping. This session will be recorded to reference and look at in the future. And please forward the link on to colleagues. And if you could kindly stay on mute till the live Q&A session, or if you prefer, just drop your question in the chat. Either myself or Neil will pick up on that question. So without further ado, over to you, Neil.
Thank you, Dale. It's great to be back. It's yeah, on the launch of Digi-Dentures, it's been absolutely amazing. The uptake and the feedback has been absolutely astounding, and meeting everyone at ClinCon and seeing the passion for the clinicians to actually be able to offer this two-stage solution to the dentist, to the patients, is absolutely amazing. And there's going to be a few people who didn't see the previous one or don't know about Digi-Dentures, so I'm just going to bring you up to speed quickly. So Digi-Dentures has been in development for quite a while. Ever since we had the scanners for Crown and Bridge, everybody's saying, what about dentures? And I said, it's coming. That time is now. So what we did was we actually developed the system with the technologies that are available out on the market to produce a denture that can be done in 2 appointments. That's scanning the patient, and then the second appointment is fitting the denture. It's good for all types of partials and also for full arches, even full falls. There are workflows and methodologies that you can follow to do any sort of case. Everything is digitally designed. So whereas with traditional dentures, we have stock teeth, and then we choose the mold which most closely matches the patient's morphology. With Digi-Dentures, we actually have the capability of customizing the teeth a lot more, which I'll come into later on. So with our Digi-Denture, we actually print the gingiva, so the pink side of the denture, in a very high quality resin. And with the teeth, we actually mill our teeth from an acrylic block. We don't print the dentures because we found that with the milled acrylic block, the strength is a bit higher, the aesthetics are higher, and the overall feel is a lot more natural compared to, especially people who already have a denture, it feels a lot more natural and familiar. So with the options that we have, so we have the NHS, My Options, and Private, and these all go up. First of all, we can do all the shades in any of them. Starting with the NHS, we have the monochromatic teeth. So where it's monochromatic, what it means is that it's the same shade all throughout the teeth. It's so if you ask for A3, it's the A3 body on your shade tab all the way through. And there's little contouring, and it's just a polished finish. On the My Options, we actually use a slightly different type of acrylic block. This actually has translucency built into the tip of it as well. So it looks a lot more natural, and also it mimics the stock teeth that you get on traditional dentures a lot more. We also put a lot more contouring in and just putting a little bit more rouging in. On the Private side, this is where you can get your actual mastery of the artwork coming through. So we can completely custom make each individual tooth. So for example, if somebody's has got the 1, 2, 3 on one side, we're replacing the other side, we can actually take that side and flip it so it looks completely natural. So each individual tooth can be completely customized. We go full on with the shading on the teeth and also on the gum work. So if the patient wants the natural gingiva matched, we can actually take it from a picture and closely match it. Here we have the prices. It's very simple. We don't grade it by the different number of teeth on it. It's just one price for any partial or any form. A lot of questions when we were at ClinCon, they were asking, where do we actually start? If I'm starting my journey with Digi-Dentures, where do we actually start? I like to almost gamify it and split it into 4 levels. As soon as you get onto the first one, the next one comes more naturally, and then all the way up to your final level. First one, get a simple patient, any partial with a stable bite. A stable bite is one where the patient can accurately recreate it, and you need at least 3 points of contact in the mouth, and the patient can like replicate it very easily. Then we move on to one with an unstable bite. So this is where the workflow changes slightly, because they might only have 2 points of contact and can't replicate the bite. So usually when a patient's got to this point, they usually already have a denture. And this is where scanning the reference denture can actually become completely invaluable for this workflow, because they're already used to that. So use that to create their bite. Once you've got this, you've actually got a lot of the techniques already down to do levels 3 and 4. It's just slight differences. Full arch, this is where it kind of splits into two. You've got full arch people who already have a full arch denture. Again, is very similar to level 2 in the case that you're going to scan the denture outside of the mouth, and then you scan the soft tissue, and then in the lab we actually place the denture back into the patient's mouth. Where you're going to have a little bit more of a difference with this is if you're doing full clearance. So for example, you're doing extraction and immediate of 2-3 teeth, scan it with the teeth, take the bite if it is there, we'll digitally take the teeth off. If they don't have a denture, we're going to bite block, but then this is where level 3 and 4 intermingle a little bit. Full dentures, people say this is your final boss level. If they've already got a denture in place, it follows levels 2 and 3. But if you don't have a reference denture at all, and the patient comes in and they've lost all their teeth, no denture, this is where we have to go to a bite block. You scan the soft tissue as normal, we produce the bite blocks, but then there's a workflow which actually takes you through on taking your normal bite, what we need: center lines, canine, and lip lines. And from that, you scan that again, the same as you would as if it was a reference denture. You don't need to send the bite back to us. And from there, we can then actually recreate we can actually make the denture from that. So depending on where you are and where your comfort level is, just have a look at these levels and then see what ones you want to take on. If you don't think, all right, the very next patient that comes in, I'm going to be doing a Digi-Denture, break it up into stages. Have a look at the Workday resources as well. So you can go to the CosTech.co.uk My Dentist, go to the Digi-Dentures page. It's got links to your Workday on the My Dentist Workday page, which actually gives you step-by-step guides for how to use your Trios system to actually do all of these. So another question that came through from ClinCon a lot was, we had people saying, oh, well, how do I know if the scan's good enough? Because they're used to doing it for crown and bridge, but you have to be mindful of that. This is slightly different, and what do we actually need for a denture? So there is 5 main points. Is 1, scan completeness. With crown and bridge, if you're doing a crown on the left-hand side, you can almost forget the right-hand side, or data holes on the right-hand side don't really matter, because as long as you've got it on one side. When you're doing a denture, we need the complete image. What happens is when you're scanning that much and you've got the scanner for that length of time in the patient's mouth, you do end up with artifacts. Artifacts being that the cheek comes into view, or the teeth, or even sometimes if you're using a mirror to hold back the tongue, the mirror gets into view. Just be mindful that it can, even a very small amount, can sometimes end up in your scan, which then could, especially the AI system doesn't know how to deal with it. Speaking with a few people from FreeShape, they said when you're scanning for dentures, actually switch off the AI function. It actually helps because it stops it from tripping up. The other thing we look for is stitching errors. So this is where you scan on one side and the other side, but then you've got 2 planes and the computer doesn't quite know how to stitch them together. So it does its best, but you end up with it crossing over, and I'll show you an example in a minute. But the way to get around that is to, when you're scanning on the occlusal table, try and catch as much as the incisal tips as you can as well. And then when you're actually scanning the buccal and the platal, the system knows where to stitch it together. The other thing, the sulcus and palate coverage. The sulcus is very important. A lot of people who are very well versed doing scanning for crown and bridge have always not had to worry about it, but especially with dentures where we're trying to get as deep into the sulcus as we can, it's very important. Training yourself how to use your mirror. There's other tools that scanning systems provide, which actually help retraction, just to help. And sometimes patients have trouble tolerating the scanning head, but with the good depth of field on these scanners now, you don't have to worry so much of it. The palette coverage, making sure we're getting back to the post-dam as well. A lot of the scans that we actually have to fail is because we don't have the post-dam actually on the scan. And the last one, bite accuracy. Take the time just to check that the scan you've got, it's the patient. If you have the patient in occlusion, make sure they're just not slightly open anywhere. If you're not sure, go back to it again. If you've got a patient who you think, okay, always had a historical problem getting the bite, you can always use your Trio system and just register a bite before you put them in the chair. And then we can use that as a reference bite as well. Here's an example of data holes to look out for. So when you're doing the scans, look at the interproximal areas. A lot of the time when we see these on crown and bridge, as long as it's not on the margin or on the adjacent teeth, you can't just fill it in. But we have to make sure that all of these are filled in because we're actually going to be engaging the Digi-Denture right into the interproximal areas to obtain the best fits. The main thing is with this, we're trying to avoid having to use any clasps, and the interproximal areas is a key area which we use to engage undercuts to ensure a good fit. So keep an eye on that side. Here's an example of stitching errors. So you can see on the incisal tips, it's almost kind of like stitched it together like that. You might have seen it on this. If you see that, if it's across the whole scan, sometimes it's better just to wipe it and start again. Sometimes you can make do with just rescanning that area. However, be mindful of if it's stitched it wrong, what's happening elsewhere in the scan. But with more practice, you will actually be able to see this as soon as it happens, and you can actually bring the scanner back to an area which was a good scan and then push forward again. And then there's the system will self-right. Here's what I was saying about the completeness of the scan. You can see we're not getting down to the sulcus. We're not actually getting to any, especially like if this was going to go for a full, we're not seeing enough of the soft tissue in the sulcus to actually engage. And also we're missing part of the post-dam on there. The denture would end up being short and then therefore losing suction. We've got FAQs which I went through last time, and I'll quickly run through these again because these are the most common questions that come up. Copy dentures possible? Yes, this is the brilliant thing about it. As you know, it's like if you're sending something to your printer, you can send 2 copies. This is the brilliant thing about Digi-Dentures that we can replicate. Can they be repaired, relined, and added to? Yes, most definitely. It is still a acrylic resin. We had this come up this morning. Patient came in, dentist called up, said patient's actually got a monomer acrylic allergy. Again, it's not designed for anyone with acrylic and monomer allergies. There is still those elements in there. But because of that, they can be repaired and relined as your traditional denture would be. Can clasp be incorporated? Yes, if we do have to, these would actually be added post-production. And what preferred workflows? Again, use the Workday resources, absolutely amazing resources. And it's as long as you hit the same checkpoints, you're going to get exactly the same results. Can conflexing be made digitally? Conflexing is still made using the traditional injection system, but you can use your intraoral scanner to scan the teeth, and we can then create a conflexing from there. Approving designs before manufacture. Yes, again, this came up at ClinCon a lot. You have If you want to approve a design or the patient wants to see it, then make sure you put it on the original prescription, because once it's entering the manufacturing process, it's very difficult to stop that process from continuing. So put it straight away on your prescription. Once you approve the designs, we send through an STL. We have got a feature coming up soon where you can actually send the patient's full profile of the face, and can actually put the actual design in the patient's mouth, and using the wonders of AI to actually replicate a smile and talking. So this is what we're going to be calling the digital try-in, which will be coming up very soon. Get more information, go through to the My Dentist, go to costech.co.uk My Dentist. This is a page that we've made specifically for My Dentist, and it provides links directly through to your own resources. It's got things about how to connect to your scanner. Again, scanning tips, prep guides. This is for if you're doing Crown and Bridge as well. Material options, the links to Workday, and the feedback form, which is most important. When you're sending your Digi-Denture, now, if we receive a scan for a denture, we will by default create a Digi-Denture. But please be specific if you want a traditional denture. If you do want a Digi-Denture, put that in there as well. It just saves the technicians any sort of ambiguity and stops any sort of delays, just in case. So that's a few things that came up a lot at ClinCon, and yeah, happy to take any questions.
Thanks, Neil. I think those the key bits in particular about just that breakdown and stages is so important, in particular for clinicians or users starting off their digital denture journey, and those tips about scanning soft tissue and silk is absolutely critical as well. So yeah, if we'll just pause for a moment. If there are any questions, or if you'd like to voice your questions on chat.
Dale, how was the feedback? Like you're in your central booth at ClinCon.
Oh yes, yeah. So
Was the excitement there for digital
It's
dentures?
it's actually a good point, Neil. So yeah, it was raised asking, I think in particular about there was a slight confusion where the clinicians were doing the design element, and I had to just reiterate that this was a key part of what the labs do, and of course highlighting the important ability of labs to do the design, because that's the missing link between sending off the intraoral scan and of course what the labs produce. But yeah, certainly it did generate a buzz to the point that our CEO asked if this technology was available now, and I said yes, it is. We just need to grow the adoption, grow the excitement, and the engagement. So yeah, I think all things considering, thanks so much, Neil, for hosting this session. It was meant to be a quick drop-in session, and of course, with this recording to be used for reference, I will circulate this recording to our greater operations team, that will then put this out in the field. But following this, if there's any questions, Neil, are they okay to drop you an email, or what's the best way to go through the landing page?
Yeah, you can go to the landing page. You can actually, there's a contact form on there. Email the office on info@CosTech, or the digital team, digital@costech.co.uk. But on our main page, there's a feedback form there, and welcome just to drop anything through. As soon as it comes through, we send it through to the best person to answer. And if it's going to be too much of a long email, we might just email and say, look, can we organise a phone call meeting?
Super. And just to add as well, I'm working with Neil and the team. We are growing the sort of clinical support tools that will be made available. Don't want to give away too much, so watch this space. We're always looking to see how better we can support our clinicians and our practices in delivering this key clinical digital workflow. So yeah, if there's no further questions, no other questions, I think we'll end it here, Neil, and I'll end the recording just to extend a thank you for taking the time out. And yeah, please do reach out to Neil and the team if there's any questions around the Digi-Denture protocol. Cool. Thank you all. Take care. Enjoy the rest of your day.
Thank you.